Senator Orrin Hatch went on the record. Senator, nice to see you, sir.
Hey, nice to talk to you, Greta. You doing all right?
I'm doing fine, Senator. I know that you guys are busy, so let me ask you about the big thing you're busy about, this health care reform bill. Do you believe that Senate Majority Leader Harry Reid is going to shove this bill through using the nuclear option? And if so, what does that mean for the Senate and for the country?
If they go by the route of reconciliation, it will be the first time that a bill of this substance, 1/6 of the American economy, is considered in reconciliation. What reconciliation was formed for is to take care of tax increases, tax reductions, budget cuts. It was to make it easier to do that by just a simple majority vote. But what it means is that you'd be doing 1/6 of the American economy in 20 hours, actually probably less than 24 hours, with limited amendments, limited debate. The American people would not be represented very well in that, and frankly, they think they can do that. And why are they rushing this so hard? It took Ted Kennedy and me 2 solid years of hard work to pass the Children's Health Insurance Program, which everybody admits is a very good bill. But it took us that kind of time. Now here we have 1/6 of the American economy, and they're trying to ram it through. Makes you wonder why, doesn't it? Makes you wonder why the sudden hurry and rush. It makes you wonder just what are they trying to pull off on the American people, and I think I can tell you.
All right, what is it then? You've now given me the tease to ask you, what is that?
Well, first of all, what the president promised, he can't keep his promises. First of all, they are going to sock taxes to the middle class, to people earning less than $200,000 a year. In fact, they're going to sock taxes to people who earn, as low as $30,000, $40,000 a year. And the way they do that, there's a $300 billion excise tax on insurers, clinical labs, and medical devices. All of that is going to be passed on to the consumer. Guess who's going to pay for it? Well, you and I and everybody else, because it isn't well thought out. Secondly, there's a $27 billion, I'm just looking at it, $27 billion in taxes on employers at a time when unemployment is 9.7% going to 10%, double-digit, unemployment. There's another $20 billion in taxes on people, in other ways. All I can say is, if you look at this bill and the high costs of it, they're not going to bend the cost curve. It's going to go up. Anytime the federal government says that they're only going to charge you $5, you know it's going to be 10, and then you're going to be lucky if it's that. They're going to actually assess for families that earn $66,000 a year or more. They're going to assess, it was $3,800 in penalties if they don't get a government, a Washington written plan. I think the chairman now says it's going to only be $2,000, but that's $2,000 to an average family that's having a rough time getting by under current circumstances. I got to tell you, why the rush? I think they're trying to pull the wool over us.
But why? What do the Democrats get out of that? I mean, you say that they're trying to pull the wool over over the eyes, but what do they get out of it?
Well, everything is geared to try and get us to a single-payer system. If they can't do it automatically, they'll do it in increments. And if we get to a single-payer system, that means we're going to have a one-size-fits-all government-run health care program right out of Washington. And if anybody believes that Washington is going to do a better job than your local and state governments and your local and state insurers and your local and state health care providers and your local and state doctors, I've got a bridge to sell to you. The fact of the matter is, I made this quote the other day. I said that if anyone believes that Washington can do a plan that will cost close to $1 trillion, cover all Americans, not raise taxes on anyone, not increase the deficit, and not reduce benefits or choices for our families, then I have a bridge I'd like to sell to you. And that's what they're claiming they're going to do, and there's no way, if you look at what they are doing, that they can do that.
All right, we only have 10 seconds left. Is this going to pass in its current form or not? The Senate, I realize they'll go through some amendments before it gets to the floor, but do you think that the Democrats are going to pass health care reform?
Well, I don't know, but they are trying to steamroll it through, and Chairman Baucus has a lot of pressure on them to try and steamroll this through, and they're going to get it through any way they can. I hope we can stop it. If we do, then we can take a step back and then work together on a bipartisan approach that the American people can accept. This one, I don't think they're going to want to accept it when, if it goes through.
Senator, thank you, sir.
You bet. Nice to be with you.